I'm Monica Robbins with your top health headlines today. Cleveland is among the big cities that stand united on their stance supporting vaccinations and denouncing what they call repeated false claims coming from federal officials. They wrote a letter explaining their position. The Big Cities Health Coalition is a group of health officials representing a fifth of the U.S. population that has worked together more than 2 decades addressing public health threats. And Cleveland Public Health Director Dr. David Margolius is the vice chair of the organization and the second signature on that letter.
Our message to the nation, all of us big city health directors, is to get vaccinated. You know, this is not a political issue. This is not an ideological issue. This is for public health, and it always has been for public health.
What is the message the letter is sending to the nation and relating to what latest federal policy has been?
There's just a ton of confusion and misinformation out there right now about all these different vaccines, which have never been political, have never been controversial. And so we're just reminding folks of how important, how many diseases like polio, like hepatitis that we've overcome through vaccination. And we certainly don't want to let our country backslide now.
Dr. Margolius says as vaccination becomes increasingly politicized, health officials felt they needed to speak up to protect their communities. They're not alone. Several medical organizations, including the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists, have broken from the CDC on vaccine guidance, and new public health organizations are forming with an aim to safeguard public health. The administration and new advisory boards, however, are sticking to their new mandates and new guidelines. A Case Western Reserve University study found the shingle shot may reduce the risk of heart disease, dementia, and death in adults over 50. Researchers looked at medical records of nearly 175,000 patients at more than 100 health systems. Follow-up was 3 months to 7 years after the shots. Now, the study hasn't been published in a peer-reviewed journal yet, but researchers presented findings at an annual meeting for infectious disease organizations. And Coca-Cola slowly selling its classic drink made with cane sugar as opposed to corn syrup. Cane sugar Cokes are common internationally, including in Mexico, but corn syrup has long been used as an ingredient for Cokes in the U.S. because of cost, and that high fructose corn syrup product has long drawn complaints from Health and Human Services Secretary Robert F. Kennedy Jr. Now, cane sugar Coke is available in select cities. Of course, you can find it online. But while Coke may be the latest, several brands have already made the switch, and several stores such as Target, Walmart, and Amazon are easy places to find it. But just remember, drink in moderation. It's still sugar. It still doesn't mean it's healthier or better for you. And also keep in mind, corn syrup is generally cheaper, more widely available than cane sugar because corn is a major American crop. So you may be paying more for real sugar. That should be a surprise for no one. I'm Monica Robbins, and that's your Daily Dose.